heart and we are examine patient heart sounds. And we have rules, and the first time we need to find place where we are listening, and the second palpation, patient carotid artery, and also after putting all of fundoscope this area place, and we need say for patient, inhale, exhale, and don't breathe. And okay, first time also, and all rooms need light and silent and the warm. After we need understand for patient. If your patient agree and we are exam our patient. Okay. Okay, we have four valves in our heart. First point, this is our mitral valve point. Mitral valve normally standing mid-clavicularis line 5 intercostal space. How we are finding? I am putting under the clavicula my finger, under clavicula, this is first intercostal space. 1, 2, 3, 4, 5, mid-clavicularis line. Normally, our mitral valve points and 5 intercostal space inside 1 centimeters. Standing this. Okay. And also I am palpation right carotid artery. Please inhale, exhale, don't breathe. Okay. And we are listening mitral valve first tone and a higher volume. And also with this carotid pulse, this is same. After second point, we are listening aortic valve. Aortic valve, we are find right side of the chest, second intercostal space and near the sternum. Inhale, exhale, don't breathe. This place, second tone, we are listening higher. After pulmonary valve, left side of the chest, second intercostal space near the sternum. Inhale, exhale, don't breathe. Okay, after that, we are listening mitral valve, xiphoid process of the sternum. Inhale, exhale, don't breathe. Okay, I have completed auscultation of the heart. If we are listening any pathological sounds and we need giving advice for patient exam, and maybe we are giving ECG and echocardiography and also make an appointment with cardiologist doctor. Bye.